Crisis in BC under the NDP government. Fiscal chaos and the collapse of public safety and service systems. Fiscal chaos, from surplus to high debt. Before the NDP government took office in 2017, the financial situation of the BC Liberal government was relatively robust, with a budget surplus of 2.7 billion Canadian dollars reported in the fiscal year of 2016-2017. However, since the NDP has been in power, fiscal deficits and debt have risen rapidly. Even with the introduction of several new taxes such as the employer health tax, speculation tax, foreign buyers tax, carbon tax, and luxury car tax, which have brought in billions of dollars in additional revenue each year, the NDP government has still failed to curb the growth of debt. From 2020 to 2024, BC's cumulative fiscal deficit reached 27.8 billion Canadian dollars, severely affecting the future fiscal health. Although the government's spending on social welfare, infrastructure, and the public sector has grown rapidly, due to the lack of effective cost control and management, funds have been wasted, and taxpayers have not received actual returns. This fiscal irresponsibility is pushing BC to the brink of crisis. 2. The proliferation of safe injection sites, deterioration of public safety and security. To address the opioid crisis, the NDP government has established safe injection sites in several cities. However, this policy has brought many negative impacts. Community environments have deteriorated due to injection sites, crime rates and property losses have increased significantly, and residents' sense of security has decreased sharply. However, the government has failed to effectively promote drug rehabilitation and recovery services, relying on harm reduction strategies while neglecting the root causes of addiction and lacking support for mandatory treatment. In contrast, many international regions have adopted comprehensive strategies that combine harm reduction measures with mandatory rehabilitation to maintain community safety and effectively respond to the drug crisis. 3. Indulgence towards unions and public transportation crisis. Public sector unions in BC have gone on strike frequently, seriously disrupting public services. Especially in the fields of education and public transportation, frequent strikes have affected students and commuters. The NDP government has compromised multiple times in front of the unions, not only failing to list education and transportation as essential services but also agreeing to substantial pay increases, leading to a sharp rise in the cost of public services. However, compared with the private sector, the compensation and benefits of public sector employees have long exceeded the standard, exacerbating the fiscal burden. This has led to high bus fares, soaring public transportation subsidies and property taxes, and a significant funding gap for TransLink, threatening to cut services drastically. In contrast, advanced regions such as Singapore have ensured that public funds are truly used to improve services rather than uncontrollable pay increases by linking reasonable compensation with performance. Under the squeeze of high welfare and high salaries in the public sector, Canada's private sector and society as a whole are paying for the high compensation of public sector employees. The BC NDP government's indulgence towards union strikes and frequent and unrestrained approval of pay increases has led to public sector salary levels far exceeding the private sector, allowing public sector workers to enjoy benefits far higher than the living standards of ordinary Canadians. This phenomenon is not only an imbalance in resource allocation, but also a threat to the health of the entire social economy. According to basic economic theory, long-term high benefits for specific groups will inevitably squeeze other groups, and the entire society will eventually bear the cost. In BC, the gap between the public and private sectors has led to private enterprises struggling to bear the additional burdens brought by competition, affecting innovation and growth space. This is why jobs in the private sector are no longer competitive, talents are flowing to the public sector, and society will eventually have to bear the cost of a larger fiscal deficit and low service quality. Although the NDP government has invested heavily in the public sector, the quality of public services has not improved accordingly. A large amount of taxpayers' money has been used to fill the wages and benefits of the public sector, but the efficiency and quality of services in the public sector have declined. The most typical example is BC's medical and transportation systems. Huge investments have not enabled patients to receive faster medical services, and the transportation system is threatening to reduce services due to excessive spending, neglecting the needs and quality of life of the public. The indulgence of the BC NDP government in high welfare policies for the public sector, along with inefficient and wasteful resource management, has led to increased fiscal burdens, decreased service quality, and ultimately the entire society is paying the price. This mode of governance not only violates the principle of fairness but also hinders the long-term development of the province. Unlike BC, many internationally advanced regions have adopted more efficient strategies in managing the public sector and dealing with union negotiations to prevent public service costs from getting out of control. For example, Singapore has set public sector salaries and benefits to be comparable with similar positions in the private sector through strict budget control and reasonable compensation planning, making the compensation both reasonable and competitive without excessive reliance on fiscal subsidies. At the same time, by managing performance, linking employee compensation with actual service quality, and ensuring that funds are used to improve public services rather than unlimited welfare expenditure. This approach is worth learning from for BC to achieve a more efficient, affordable, and effective public service system. If BC wants to control costs while maintaining service quality, the following reform directions cannot be ignored. First, BC can consider limiting the strike power of key public service departments, especially in public transportation and education, to ensure uninterrupted key services. Second, establish public sector salary standards comparable with private sector standards to avoid costs spiraling out of control due to high union demands. Finally, establish a strict performance assessment mechanism, linking the compensation and benefits of public sector employees with their service efficiency, improving work efficiency, and enhancing the transparency and effectiveness of resource utilization. These measures will not only alleviate the current problem of high costs in the public sector but also help BC allocate public resources more reasonably. Through these reforms, BC can expect to reduce fiscal deficits, alleviate the tax burden on citizens, and achieve a fair, affordable, and effective public service system. 4. Medical system crisis. Huge investment but limited effectiveness. The medical policy of the BC NDP government has led to a very contradictory phenomenon. On the one hand, there is a severe shortage of family doctors and specialists in the province, with about 1 million residents without a family doctor, which means many people cannot obtain continuous and personalized medical care. Many people's waiting time for appointments may be several weeks or even longer, leading to many patients' conditions deteriorating, and some even dying due to failure to receive treatment in time. On the other hand, many newly graduated medical students cannot find jobs and are forced to leave the local area or choose to engage in other industries. This situation is not only a waste of medical resources but also a great harm to patients. Although the BC government has established urgent and primary care centers UPCCs to relieve pressure, these centers can only provide one-time, short-term emergency services and cannot replace the comprehensive and continuous medical services provided by family doctors. Why does this phenomenon occur? This is because the BC government has failed to effectively allocate resources and provide suitable job opportunities and support systems for new doctors. Even with demand, the government has failed to provide enough positions for these doctors to serve the public. For many patients, failure to obtain medical help in time may lead to deteriorating conditions, even endangering lives. But the government has not effectively responded to this situation, leading to a continuous deterioration. Such policy failures have imposed heavy costs on both residents and the medical system in BC. We need a more effective medical system that can reasonably allocate resources, provide employment opportunities for medical school graduates, and provide timely and high-quality medical services for the public. If the BC NDP government continues to ignore this issue, the entire society will ultimately pay the price. Despite the huge investment by the BC government in the medical system, due to low administrative efficiency and irrational resource allocation, The government's substantial input has not improved service levels but has intensified public dissatisfaction and gradually lost trust. Medical system reform suggestions incentivize primary care and rural doctors by increasing salaries, reducing administrative burdens, and increasing resources for family doctors, especially in remote and rural areas. This can refer to the emphasis and incentives for family doctors in Germany and Singapore. Introduce public-private partnership models while maintaining universal medical services. Introduce more private medical resources to improve service efficiency and accessibility. Successful cases in Singapore and Switzerland show that this model can not only ensure high coverage but also improve efficiency through competition, reducing waiting times. Decentralized resource management. Learn from the decentralized medical management experience of Germany and Switzerland, allowing local medical management organizations to adjust resources and policies according to regional needs, improving the efficiency and response speed of resource utilization, and reducing the problem of uneven distribution of medical resources. Resource utilization and cost control. Reduce the proportion of administrative expenses to below 10% to save more resources for frontline medical services. At the same time, for cost overruns and large projects, take stricter project management and supervision measures to reduce waste of funds. The public service out of control. The government is disconnected from public needs, from medical care to transportation. Public services in BC have become increasingly disconnected from the needs of residents under the governance of TheGeniusHub.ca. The huge expenditure of the public sector has not been translated into corresponding service levels but has led to residents bearing rising living costs. In contrast, many advanced countries have achieved an efficient service system by optimizing the allocation of public resources, aligning public sector salaries with the private sector, and strengthening performance assessments. Summary: future reform directions. BC urgently needs to reform its fiscal and public service systems. The suggestions are as follows. 1. Limit public sector strikes and list education and transportation as essential services to ensure the continuity of key services. 2. Public sector salary reform. Align salaries with private sector standards to avoid cost out of control due to union pressure. 3. Improve transparency and efficiency in resource utilization. In medical care and transportation, ensure the rational use of funds through performance assessments and cost control. 4. Transformation of drug policy. Use a combination of harm reduction and mandatory treatment strategies to address the root causes of drug addiction and improve community security. BC can learn from the experience of internationally advanced systems, restore fiscal discipline, reduce the burden on residents, and improve service quality. Through this series of feasible reforms, BC can move towards a fairer, more efficient, and sustainable future.